Okay, I've got confirmation from IT.
Trauma expected in 6 minutes.
Any of those patients, they need to go.
Okay, I've got 3 spaces in recovery, 3 spaces in recovery.
It's a training session for A&E staff in Brighton. They're using a board game developed by one of their own A&E consultants. And the scenario is a full department, short of staff, with more patients arriving every few minutes.
Just so you know, 4 ambulances have arrived and they're waiting to be offloaded.
The whole point of doing it is because, as everybody is well aware, there is a serious overcrowding problem in the emergency departments at the moment and in the hospital as a whole. And that is a national problem, but also it's an international problem.
So we've got another pre-alert. There's been an RTA on a main road.
It is quite important to practice in a safe environment stress and to stress test our processes and pathways and see if they actually work or if they don't work. And if they don't, what we can do about it. It is lots of fun, there's lots of laughter, and it is very amicable. And actually there's no winner at the end of it. The patient obviously is the winner.
Okay.
And add to that, there's always the possibility of a major incident to complicate
Stand
the
by on a
process.
major incident. Apparently there has been an explosion in the town centre.
So we might need to get one of...
Since the game has changed to the major incident mode, as you're watching it, that's quite atypical. To be honest, the challenge of us constantly having to rethink space and to juggle and sometimes potentially consider what is the safest out of safe but not ideal options is quite a commonplace event.
They might divert some of these patients away to Worthing and Hastings.
Fine.
I'm getting more information.
I am telling you we need to move some patients.
Yeah.
I'm not sure if you guys would agree, but the stress is quite real. You feel,
And I think it's a good...
The board game has been tested in a number of different hospitals and has even begun to sell with buyers both in this country and in places as far afield as Canada and Japan, perhaps proving that dealing with busy, stressful A&E departments is not exclusively an NHS problem. Mark Norman, BBC South East Today, Brighton.
And we have 4 patients which still need decisions.
Okay.